8, the Honourable Member for Cumberland-Colchester.
Hear, hear. Well, thanks very much, Mr. Speaker, and thanks for my colleagues for being here today. You know, whenever we have an opportunity to bring a private member's bill to this House, it's obviously an important and exciting day, and I know some of my colleagues on both sides have, at least over here, have had the opportunity to do that, and some of them even successfully, which is a great feeling. Especially when what often private members' bills attempt to do, of course, is to speak on behalf of those people who asked you to come and do this work on their behalf. And when you have that opportunity, that's when you really have a significant opportunity that can have very, very personal meaning attached to it. And certainly as I look at this bill C-323, which as the esteemed speaker has spoken about, has had a bit of a tumultuous course inside this House, even having been adopted in the fall economic statement in some form, at least. Many would suggest that should be taken as a great compliment, that the NDP Liberal government would see the wisdom of things that we do on this side of the House, which happens very rarely, I would suggest. But we should just be happy that it happened. Maybe that's, since it's a Friday, we'll just be happy that it happened nonetheless. So the original form of Bill C-323 recognized that psychotherapy and mental health counseling services are not exempt from GST and or HST, which of course thereby makes it significantly more expensive when Canadians have to pay out of pocket for those things. And if you do the math associated with it, depending on where you live, removing those services from GST or HST could mean that every 7th or 8th session would in essence be free, although we know nothing is free. Certainly on this side of the House we get concerned with the use of the word free. That being said, one of the significant types of therapy that was omitted originally was registered massage therapy services. And when we begin to look at how people recover from their own mental health stress and distress and mental health illnesses, we do know that registered massage therapy services can be a significant part of that. Many people choose to use registered massage therapy services on a regular basis as maybe a health maintenance type of program. And of course, many people choose to use it with injury and other illness as part of their ongoing self-care regimen. So when we begin to look at the utility of registered massage therapy services, I would suggest that adding it to this private member's bill would make perfect sense, the way it dovetails in with self-care that Canadians so desire. Speaker, I know that I've talked a bit about this before, but I think it bears worth repeating that the mental health difficulties and indeed perhaps even the crisis that exists in Canada is ongoing. We know that after age 40, so this would be more of a cumulative sense, that 1 in 2 Canadians will have had a mental health diagnosis during their lifetime. So obviously, you know, if you're fortunate enough to have somebody sitting beside you, maybe you could look at that and understand how significant that really is when you understand it's every other person in Canada at the current time. Sadly, Speaker, and I'll try not to irritate the NDP Liberal government too much, because I do want them to pass this bill, but I cannot not say that I'm incredibly disappointed with their announcement of the $4.5 billion Canada mental health transfer, which has never been allocated. Now, I know, Speaker, that the folks on the other side of the House will go on and say, well, we've allocated it in a different way and this and that. And I'm not entirely convinced of that. I would like to see the numbers and understand where the $4.5 billion is. But that being said, I do think it's again, I'm not trying to be irritating to the NDP Liberal government, but it's a bit of a cruel trick when you say to Canadians that this country values mental health treatment and support for people who suffer with mental illness. And as the NDP Liberal government said, we will transfer $4.5 billion to provinces to help strengthen mental health treatment and diagnosis. And then, of course, it didn't happen. That's the proverbial rug being pulled out from under you. And that's a sad day. That's a big announcement, and it just didn't happen. And that's the way it went. To further underscore the severity of mental illness in this country, we know that from studies being done that the cost to the economy of our great nation is about $51 billion with a B dollars every year, lost productivity, direct health care costs, and mental health quality of life issues for people who suffer with mental illness. It is not insignificant. Even though we talk in this House easily about billions of dollars, $51 billion is a heck of a lot of money. And how do you put a price on individual suffering and the angst and distress that it causes? I think that one of the things that has been done reasonably well in our great country is the ability now that people have to understand that A, mental health issues are incredibly common, but also B, that it's important that we have the courage and the ability to speak out about them. And certainly initiatives like the Bell Let's Talk Day have been important. I'll give a shout out to Kids Help Phone because I think that they've done incredible work. And certainly my colleague from Caribou Prince George's advocacy work with respect to the 988 suicide prevention hotline. Yeah, absolutely. And I'm absolutely thrilled, I have to tell you, Speaker, that he will speak on Bill C-323 later. And his passion and his compassion for Canadians always comes through in everything that he says. And I know that when he speaks, it really comes from the heart, and that has a significant amount of meaning for me, and I'm happy to call him a friend and a colleague. On that vein, Speaker, though, we do know, sadly, that 11 Canadians die every day by suicide. And it goes without saying, of course, that that's 11 Canadians too many. You know, when you begin to think about it deeply as an individual and begin to think how bad must things be in your life that you begin to think that your only option is to take your own life, that things are that incredibly difficult and that there's no future that you can possibly see. But certainly if you have that opportunity and you realize that there is a 988 number to say, hey, I can reach out to this number and have someone answer me, then we know that the likelihood is helpful that you may see a different picture when you're finished with some of that talk therapy, as we might say. Accessing talk therapy, accessing help from a therapist of whatever kind you may choose has become exceedingly difficult in this country. And we know that that's become more and more difficulty because Canadians do not have access to primary care. 7 million Canadians do not have access to primary care in this country. And why is that important? It's important because the majority of the way that you access care in this country is by having a primary care provider. If they are unable to meet your needs, your service needs themselves, then they will reach out on your behalf and help you find someone who can. And even in the town of Truro, where I live, back in Nova Scotia, having been a family physician there for many years, and when people finally make that decision to present themselves, for instance, to me as a former family physician, and they've made that decision that I need to get some help, they don't want to wait months and weeks to get that. You know what? I know that they have struggled with that decision often over many weeks and many months. And when they finally make that decision, that it's important that they get the help in a timely fashion. And sadly, at the current time, that's just not available to Canadians, the timely help that they need. And we need to be more responsive as a country to Canadians who do need mental health care. And not just for the financial reasons, but I think most importantly for the mental health quality of life that Canadians want to experience with their enjoyment and their inclusion in society of enjoyment. Speaker, I think that we also have to talk a bit about the opioid crisis when we're talking about mental health in this country. People with a mental health diagnosis are twice as likely to suffer with substance use disorder and misuse of substances as well. We all know in this House that that is a crisis inside this great country. I'm not going to stand here and tell you that we don't disagree on perhaps how it's being treated, but I do think it's important that Canadians understand that we all would agree, and certainly I don't think I'll get much pushback from my colleagues, that there is a crisis with respect to opioid use in this country. And we also know that incredibly sadly and disappointingly, 22 Canadians are dying every day with respect to opioid overdose. As I said, we may differ on how it should be tackled. That being said, we do know that resources need to be given to help with things like prevention. How do we try to help ensure that future generations of Canadians do not suffer with substance use disorder the way that we're seeing in our country now? We still also, I think, believe in this country that there needs to be disruption of those who deal drugs and profit from the suffering of others. I think that has to be an important part of it. And of course, recovery and how that looks, quality, meaningful recovery. We can argue about that, but we need to make progress with respect to recovery in this country, especially in terms of those who want to choose to attend recovery and get their lives back in a meaningful fashion and mend those relationships, which have become very, very difficult to mend. They need vocational training, they need housing, they need support, and I think that we all know that, and it doesn't matter on which side of the House you're arguing the point. This is a huge problem, and I think in spite of the fact, as I said, Speaker, that we know there are differences in perhaps how we want to approach it, we have seen compassionate testimony on the Health Committee, and I know that by virtue of the fact that all of us agreed to extend the study on opioids in Canada, that we know that this is a significant problem for many Canadians. So, Speaker, when we turn our attention to unmet mental health needs, a third of Canadians have unmet mental health needs, and that is a significant number of people. And we know that currently 20% of Canadians are suffering with mental health issues, which when you do the math, if we want to use 40 million Canadians, that's quite simply 8 million Canadians. This is a significant problem in our country, and we need to devote some resources on fixing that problem. Bill C-323 is not a cure-all. It's not a panacea. It's not something that if we pass it in this House, that suddenly all of the mental health issues are going to be gone for Canadians. Boy, I wish that I had that opportunity. But what it will help is for those who are seeking help and are paying out of their pocket, that we will, as a country, not charge them GST and HST on the services for psychotherapy, counseling therapy services, and registered massage therapists. Hopefully, if the House here sees fit to pass the amendment and ensure that this bill is significantly different, and therefore it will be sent back to the Finance Committee since it deals with taxes and not to the Health Committee. Because they don't want us, I guess, to deal with money there, just other important health-related issues. So, Speaker, I think that I will leave it at that. Hopefully Canadians now have a good understanding of the compassion and concern that we on this side of the House shared with our NDP and Liberal colleagues have for Canadians suffering out there, and that we see fit to help alleviate that suffering in some way, shape, or form today here in this House. Thank you.
Questions and comments. The Honourable Parliamentary Secretary, Government House Leader.
Yes, thank you, Mr. Speaker. And I guess the question I would have for my friend across the way is that over the years we have seen a substantial change in attitudes towards mental health in a positive way, where we have seen governments and people in general recognize that mental health is, in fact, health. And should be a part of having a healthy body. A part of a healthy body is a healthy mind. And if I can just get the members' take on that particular issue.
Well, member for Cumberland Colchester.
Well, Speaker, you know, often in this House we have a lot of back and forth. Some days you wish it were different. Today it will be different. I will tell the member opposite that I agree with him wholeheartedly. With respect to the fact that that mental health and physical health go hand in hand. I think that, as I said during my comments, the Canadians also understand that clearly, that the difficulties you may have if you're suffering with things like anxiety and depression, certainly those impact your ability to have a healthy lifestyle as well. And vice versa. We know that the interconnection is quite significant. For instance, if you're diagnosed with diabetes, that creates a significant amount of anxiety and distress for people often as well, as do many other diagnoses, cancer, heart disease, etc. And that they are incredibly linked together, that biopsychosocial model, which is why we often also talk about the need for appropriate housing, and healthcare services go hand in hand. So we know that there is that incredible link. We wish that we could, you know, ensure that they weren't, but my colleague is absolutely right. There is that incredible connection of mental health and physical health.
Questions and comments.
The Honourable Member for Pierre Boucher, les Patriotes Verchères. Thank you, Mr. Speaker. First of all, I'd like to congratulate my colleague on his private member's bill. Whether or not the bill is passed, it will be a victory given that it's been integrated to C-59. Now, I wanted to table an amendment in this House to lay out the fact that there is specific Quebec expertise that has been developed, for example, psychoeducation and on sex education, sexology. I wanted that to be recognized in this bill. Unfortunately, that didn't happen. Does my colleague think that these professions should also benefit from these tax benefits? And when it comes to Bill C-59 or his bill, does he think that the interpretation should be in favor of having those professions included?
Cumberland Colchester.
Well, I'd like to thank you very much, my colleague, for his comments. And once again, I would suggest to Canadians out there that our sexual health, of course, is an important part of who we are as people. There's no doubt about that. There are some nuances, I think, that we need to be mindful of, not from a health perspective, but from a perspective of taxation. And, you know, are we then meandering a bit into the difficulties with professions that are not registered or self-regulated professions? And I think that those are the things that we need to be careful of. So without that study, and I apologize to my colleague that I don't have that knowledge at the current time, so for me to comment on it and say that they should be included would be a great thing to do. But from a physical and mental health, sexual health perspective, of course that makes perfect sense. That's all part of being a human being, and we're all thankful for that.
Questions and comments. The Honourable Member for Victoria.
Thank you, Mr. Speaker, and I want to thank the member for his speech and for his advocacy on this. I also want to give thanks to the member from London Fanshawe who put forward this bill first and has been a strong advocate for mental health professionals and those seeking mental health. I also want to share a quick story from a counsellor who I spoke to who talked about what this would mean and how she's been trying to make sure that mental health services are accessible to her patients and how she doesn't want to pass along these costs. Can the member speak about how we need to work to ensure mental health is accessible to all?
Very quickly, the honourable member for Cumberland Colchester.
Well, absolutely, Speaker, and I thank the member for a question. You know, I think that with my comments inside of what I've already spoken about, that we can't underscore the need for mental health care and the rapidity with which Canadians need to access it. I just want to highlight, as I said originally, that when somebody makes a decision to say that, you know, my mental health is suffering, it's been a long and difficult, most often a long and difficult decision for them to come to that realization. So we as a society need to be mindful of that decision and ensure that timely access to health care is available. And I do believe that that is exactly what Canadians have an expectation to have happen to them. Thank you.